So vCARE, Virtual Coaching Activities for Rehabilitation in the Elderly, is a project that we started in Casa di Cura del Policlinico, which is a neurorehabilitation hospital based in the center of Milan, dealing with mainly patients which come from stroke events and neurological diseases. As a matter of fact, in the rehabilitation, we recover patients after an acute event, and basically we inbound them for about 2 months, where the patient are involved in high intensity rehabilitation programs, which often provides results. But the open point is what happens when they come back home. How does it work, the rehabilitation? And in this sense, vCARE projects try to, let's say, virtualize, digitalize the therapist, providing a virtual coach in the rehabilitation. So the basic point of discussion is how much to manage the continuity of care in between the hospital and the rehabilitation at home, trying to provide useful tools in order to monitor the health status and the behavior at home, optimize the treatment, and provide advices. These are the key aspects of vCARE, trying to enhance the quality of life, and where the starting point, the more complex point, is to start from the clinical pathway, trying to embed in the solution the end part of the rehabilitation pathway, which has been performed in the clinic, and this becomes the basis for rehabilitation program. On top of that, there is a big discussion about how much to empower the patient, how much to encourage self-management. So which are the best digital tools which could provide to this kind of patients, which most of them are elderly, to use this kind of support. And then, as already said, the point of personalization. So how to move from a standardized rehabilitation pathway to a personalized pathway which could benefit from the knowledge of the behavior of the elderly at home. And as often happens in the European project, these piloting actions will be performed in many settings by different partners. And in this sense, we try to cover 2 different pathological domains. One is the neurological one, and the other one is the cardiological one, acting on 2 post-acute events like stroke and heart failure, and 2 chronic conditions like Parkinson's disease and heart attack. I will speak about our example, which deals with stroke, but then I also have examples, not for this presentation, for Parkinson's disease, which comes from Spain, heart failure, which comes from Romania, and the heart attack, which come from Denmark. The virtual coach is the final interface dealing with the elderly of a platform, a more complex solution, where the 4 main services, the 4 main actions which he is performing with the elderly, so to provide feedback, motivational feedback, the sensing action in order to prevent risk factor, the reminders about the training program, and the advices on how to improve according to the performance here showed in the different cycles of rehabilitation, depends from the solution, where the pathway is the last layer of a more complex architecture, which has its heart in an engine dealing with machine learning, and interoperating with some, let's call it digital therapies, anyway, some digital services which are released to the patient. One of these is a gaming solution provided by a company called Imaginary, which will be shown in the next presentation. Clinical pathway. Clinical pathway is something which is in place in our clinic, and we have deployed in a more home-like setting, where the digital therapies on the right side are empowered by the knowledge of the patient, which comes from the clinic, so the patient characterization. This case of evaluation, we provide the baseline on which to compare the result coming from the digital therapies, and then the prescriptions, which depends from which are the needs of the patient going at home. In the stroke rehabilitation, we have prescription about physical therapy, cognitive training, risk factor modification, emotional and social rehabilitation, and pain management. What I would like to underline in the discussion about therapies, digital therapies, is the loop which we are running in terms of algorithm, of reinforcement learning behind the scene. As we have seen, the clinical patient assessment is something which starts the process. The pathway setup depends from the sensibility of the physician making a prescription of the digital therapies before going home. The virtualization is the technical side of the setting of the whole solution in the home environment, and then we have the routine process, the ongoing process, cycle by cycle, where the gaining of knowledge which comes from the first cycle goes to improve the level of knowledge of the performance of the patient, while the physician is not off the line, but inside the circle, is best for what regards the exception ending, and in some way to skip away from the digital therapies and come back to the analogical therapies again. The level, the most interesting phase of the project comes, as I mentioned, about the learning. But the learning is something which should goes in the direction on the personalization and adaptation. And we expect to perform, as soon as we run to the different validation stage, 4 levels of personalization. The one of the pathways, so the one related to which are the expected goals and the expected scheduling of the different activities, the personalization of the different digital therapies in terms of setting to be prescribed, the alerting system, and the feedback, the motivational feedback for the user. This kind of approach, of course, needs a lot of time. Where we have foreseen 2 years of validation in different stages. The first stage is a stage in the tech labs. Now we're running a stage in the living lab, and then we will have the final stage at home in the pilot test in the last part of the project. Tech lab phase is a phase which was focused on testing of the different treatment activities. So depending from the requirement and the services, which I just very quickly highlighted, we have been running across the different treatments. But what is more interesting now is to embed this kind of treatment into the clinical settings. And to do this, we are working on the side of the living lab, as it was mentioned by Professor Hermans. These are very useful environments as they are shaped in a home-like setting. So the patient can perform activities in ecological system, but this is controlled and supervised by a therapist. In our case, we have this kind of apartment inside the clinic. It's a space used by the occupational therapy, where we have installed the technology inside the room, and we are going to perform all the expected evaluation before going home. So the main objective of the living lab phase is to test the personalization side of the project before we go in the last phase. The last phase is the phase driven by a clinical product before going to the final validation, and so the confirmation development, which should provide elements also for the exploitation. In this setting, the clinical protocol is divided, like I showed before, in the different disease side, where a fixed number of patients is involved, and the results are compared to a conventional therapy in a control group. In this last phase, we will introduce also clinical outcomes, which relates to the enhancement of the quality of life, risk factor reduction, the adherence to the care plan at home, and the personalization. But at this point, I would give the floor to show you an example of these instances, the one related to the gaming, which is provided by this company, which is based in Milan, which is called Imaginary. And this is the list of the project partners which are coordinated by the University of Dresden. iSprint is part of the game, and so let's talk after the next presentation.